Garbett talking to you from the Waterloo region, and welcome to today's webinar on telehealth physiotherapy, Keep Moving Online, presented by Carla Andrews. We are so thankful that Carla Andrews has made time in her busy schedule to help us learn some physiotherapy exercises, as we all are obviously in the midst of COVID, and one thing that's important for us is to keep moving and to stay positive. With that being said, I'd like to introduce Carla Andrews, who's a registered physiotherapist who owns and operates Andrews In-Home Physiotherapy in the Guelph area. She has a special interest in the role of exercise and physical activity in the management of Parkinson's and is a certified Parkinson's wellness recovery therapist. Working with individuals living with Parkinson's is the focus of her community-based practice, and in light of COVID, she is working with more clients online offering video conferencing sessions. She started this telehealth service last year to reach people in Northern Ontario who were looking for physiotherapy guidance regarding their Parkinson's. She will be more than happy to answer any questions you have at the end of this webinar, and we are so thankful that she is here. So Carla, warm welcomes, and please take it away.
Thanks very much, Caitlin. And thanks again for having me. I think many of us, myself included certainly, whose daily routines are very restricted right now, we are looking to connect with others and feel a sense of community because we are having to be so physically distant. Certainly the Parkinson's community has unique needs, like others with exceptional healthcare challenges. So the topic of telehealth, I think, is certainly very important right now and very appropriate. It's a tool that many clinicians like myself are using to stay connected with their clients and offer them ongoing support during this unexpected and, as everyone is saying, unprecedented health crisis we are facing. So I am going to speak just a little bit about telehealth, how it works, and essentially what telehealth looks like in different realms, and then speak a little bit about some principles of exercise relating to Parkinson's. And we are going to spend some time exercising today, so I'm hoping people will join me, and then do questions at the end. So regarding telehealth, essentially it's a long distance relationship to address care needs. It's the use of technology to deliver healthcare and education at a distance. You know, it's often used as a synonym with telemedicine, kind of interchangeably. I'm not kind of splitting hairs whether people say telehealth or telemedicine. It's essentially, you know, a therapist or some sort of clinician or healthcare provider either working with a client. It could be two healthcare professionals consulting about a patient, you know, one in one city, one in another. There are essentially various remote monitoring instruments and tools right now that people may be using in their homes. Example one might be, you know, people wearing a blood pressure monitor or some sort of heart monitor that's being evaluated at some other center. Those are all ideas and examples of telemedicine or telehealth. I certainly, in my practice, you know, I consider telehealth, you know, having phone consults with people, doing video conference calls, or, you know, exchanging information via email. So in terms of benefits to telehealth, I mean, it's nice because it happens kind of in the comfort of your own home. There's no travel time, there's no waiting room, and certainly, you know, amidst COVID-19 right now, that eliminates the risk of picking up or spreading a virus. You know, certainly my practice right now, I'm not actively seeing any clients. I'm not going into people's homes unless it was absolutely urgent. And I know, like I say, doctors' offices are doing the same, as are other various rehab facilities. So it is certainly a very appropriate and great tools for people to be using right now. It still offers what I call real life scenarios in terms of being able to see someone, they can see me, I can, you know, have a look at their surroundings if they're having an issue with something in particular in their home. An example I'll give was someone says to me, I really have a hard time getting out of my favorite chair. Can you give me some suggestions on how to make that easier? Maybe exercises to strengthen my legs. Can we make modifications to the chair, or what would you suggest? So you can address, like I say, real life scenarios through telehealth. It offers access to more specialized services, particularly for people who live, in rural or remote areas. It gives them an option. And again, I mentioned at the beginning of the webinar, this idea of community connection. And I think for people who live with chronic health conditions like Parkinson's, it's imperative that people feel connected. With all the community programs being shut down right now, physio clinics, the YMCAs, gyms, etc. It's an enormous challenge to keep people moving and to keep motivating each other to keep moving. So I'd like people to kind of think that anyone can offer their own informal telehealth support to each other. And by that, I mean phoning or emailing a friend, asking them what their plan for physical activity is today. Are they going to ride their stationary bike? Maybe they have a treadmill. Maybe it's a nice day. They're going to go outside and walk for half an hour. That's really important to reach out to each other. And I think certainly we're more likely to carry out a plan if we know that someone is going to be checking back in with us to ask us, how it went and how your exercises went yesterday. So I think that's an important piece of all of this. So I'm going to speak more specifically around this idea of, a video call or a video conference call, because some people aren't familiar, and many people are. It is essentially like if people have used Skype, or if they're familiar with FaceTime, I can see the person, they can see me, except when a healthcare practitioner is doing this sort of platform for professional services, we need to be using what's called a secure online platform. So we're not just using Skype or FaceTime. You need to have a good internet connection. There needs to be a working camera on whatever device you want to be using. So whether that's your phone, perhaps it's a tablet or your laptop. Headphones can be helpful to have a better, so you can hear better during the consultation. You don't have to have that, but it can be helpful. And it's good that if wherever you're set up in your home, that there's space around you that allows you to move around. Because I normally ask people, can you please stand up for me? Can you walk over there across the room? So it's good if people can be moving around. And essentially, it's just like booking a regular appointment that I would do with my clients, either by phone or email. And then I send the person a link in the email, like you would have received today to join this webinar, inviting you to attend a meeting online with me. And then we have a predetermined time, and then you click the link at that time, and it takes you into what's literally a virtual waiting room. And I can see that you have entered the waiting room, and I can start the video call. So it is quite simple. And online physiotherapy sessions, can look very much like an in-person session. If it's someone who I haven't if I haven't worked with them before and it's a new client, I would do a detailed history like I normally would, evaluating symptoms, various movements, asking the person to do various things, observe how they're walking, and then prescribing appropriate exercises, answering questions that they may have. I'm certainly able to make recommendations around equipment. If they, for example, say I'm really having a hard time, getting in and out of bed, if we're able to bring the tablet or the device into the bedroom, that's certainly something we can look at, and I can make recommendations accordingly. Perhaps they need a certain type of walking aid. So like I say, a lot can be accomplished in an online session, and like other therapy appointments, we'll often then book a follow-up to reevaluate and see how things are going. Do things need to be changed? Do exercises need to be progressed? So that's kind of in terms of, in a nutshell, what telehealth can look like for physiotherapy practice. I want to talk a little bit about exercise and specifically targeting certain symptoms with Parkinson's through exercise. There's some common motor symptoms that many individuals with Parkinson's experience. And as much as possible, we want to try and address these through exercise, of course, in combination with medication support. So the first one, muscle rigidity. People with Parkinson's often say that their bodies feel tight, that they might describe cramping or pain in an area, and that they tend to become more hunched forward over time because their muscles are rigid and gravity is pulling them forward. So working in various positions to stretch out and decrease muscle rigidity and improve posture is really important. The next thing, motor symptom I'd like to discuss is bradykinesia, which is meaning slow movements. And bradykinesia is a speed and an amplitude problem. And there is this inadequate drive and messaging from the brain to activate various motor systems in the body. And what I mean by that is motor systems that are responsible for helping us move our arms and legs, the motor system that powers our voice, that enables us to do small, fine movements with our hands. So there is this inadequate drive from the brain in people with Parkinson's to activate these systems. So when we are looking at prescribing exercises, really want to drive lots and lots of effort across various motor systems. So again, arms and legs, including your voice, paying attention to the hands to improve dexterity and coordination. So I joke with my clients often, I want you to, go big or go home with these exercises, because I really want, and I'm looking to achieve very high effort, large amplitude, whole body movements to combat the slow, small, everyday movements that we tend to see with Parkinson's. Another thing that's important to target is in coordination and balance. So it's important to practice exercises and movement patterns where people are flowing from one movement to another. So an example I'll use in a very practical sense, if someone is lying on their back and they want to get out of bed and they're finding it difficult to, roll over, get onto their side, bring themselves into sitting. There's a lot of transitions there that people who don't have Parkinson's, we don't really think about it. But with Parkinson's, it's the loss of automaticity with movement. The movements just aren't automatic anymore. So it can be very difficult to make these transitions. And even something as going from sitting to standing can be challenging, because the brain needs to be constantly focusing on what it wants the body to do. Things aren't automatic anymore. So anyway, it's important to practice various movement patterns and be able to flow from one movement to another. And again, doing that in various positions, in sitting, lying down, standing up. There's all sorts of different ways we can work on this. So in terms of, prescribing appropriate treatment, physical activity and exercise for people with Parkinson's, there's lots to consider to really have a comprehensive program. And of course, I'm just speaking from a physiotherapy perspective. People who have Parkinson's obviously work with speech language pathologist frequently, and that would be a whole, program pertaining to speech. But from a physiotherapy perspective, I like to certainly offer lots of education and training around posture, because it is the foundation for movement. So it makes sense that if people are having changes to their posture, it's going to affect their balance, their walking ability, and many other things. So like to incorporate lots of exercises and activities that force people to work in different postures. So if you can get on your stomach at all, I like people do some work on their tummy. If that's not possible, we have lots of options. We always need to incorporate exercises that include working lying down on your back, sitting, standing, etc. So really important. Use of a mirror can be very helpful for people when addressing posture, because frequently they don't feel their bodies the same way. There's a change in their body awareness with the disease. So mirrors can be very helpful. The use of walking poles is great tool to improve one's posture, as well as, it makes the intensity of a walk, that much more, and it helps people to train to swing their arms when they're walking, because diminished arm swing is certainly something that we see commonly in Parkinson's. Aerobic fitness is a critical component of a treatment plan, whether it's walking using a treadmill, a bike, swimming, whatever it is. It needs to be included as part of the regular treatment, and we are looking for that activity to be somewhat challenging and somewhat difficult when we're doing it. So it can't just be necessarily a really kind of stroll in the park where I'm not really finding this hard. It needs to be challenging. So I say to people, if it's not challenging you in some way, it's not changing you. And we want that brain change with the exercise. And then functional movements and whole body training. So working on things like, walking in various directions, forward, backward, sideways, stepping, making turns, getting up and down from the floor. And in terms of whole body training, we're thinking really getting people to bring awareness to their voice, to their breath, tracking movements as they move with their eyes, and paying attention to what their hands are doing to address fine motor symptoms. So that's this idea of whole body training is really specific to Parkinson's, because we need to drive effort and pay attention to various motor systems. So we're going to move into the exercise portion of the webinar. So certainly safety comes first. And I don't know everyone that's listening in today, and I certainly can't see anyone, but people are, obviously work at your own level, work at your own risk tolerance. You shouldn't feel any sharp pain with any of these exercises. If anyone's experiencing shortness of breath, they should stop immediately. I'd like individuals to participate if they can and they'd like to. I'm not looking for people to be perfect when they're trying to do these exercises, just that you try. And I think that, as much as you can, though, try and, if you're familiar with some of these exercises or you've worked with a physio before, really looking to try and put as much effort as you can into the movements, and that there is an intensity there. So the goal is to participate and to have fun. I'm going to demonstrate, first we're going to start with a warm-up and then proceed into some exercises that really target movements that tend to be challenging for people with Parkinson's. So things like being able to shift your weight from side to side. Again, whether you're standing or sitting, that can be challenging. Or, you even think about, you have to shift your weight in bed when you're trying to roll over. So weight shifting is something that we pay a lot of attention to with Parkinson's exercises. The ability to rotate and turn your head and your trunk is important. We want to focus when we're doing exercises on standing up really tall or sitting up tall. And often people have trouble lifting their feet to step. So the exercises, again, are going to really pay attention to trying to lift the feet and the legs up high, almost exaggerating movements. So I'm going to demonstrate a seated version as well as standing options for people. If you normally are comfortable exercising in standing, and you don't have significant balance issues, again, I'll leave that at your discretion, but you may consider having a chair or a counter nearby for your balance if needed. And it's important to use our voice when we exercise. Again, this idea of addressing multiple motor systems. And when we use our voices, it helps to drive force through our entire system. So you're actually going to move better. So I encourage all of you to count along with me as we're going to move through the exercises. With regards to people who are going to use a chair, certainly a firm chair is ideal, like a kitchen chair. If you have one without arms, it's even better, but not essential, but certainly a firm, like a kitchen chair, is the best thing to be using if possible. So I'm going to change the screen over here to allow you to see me. Okay. And please let Caitlin know if you can't hear me. Okay, so we are going to start with a warm-up first. So our warm-ups, we are going to start with big arm swings. I want people really trying to keep your arms big and as straight as you can going forward. And I'm going to count another 5, 1, 2, 3, 4, and 5, and backwards. Same thing, stretching as much as you can through your shoulders, sitting up as tall as you can, and counting 5 again. 1, 2, 3, 4, 5. And the next exercise is a cross body crunch. We're going to take our elbow, we're going to go for our opposite knee and come back. If you can't bring your elbow to your knee, that's okay. Can you reach for your opposite knee with your hand? Can you reach for your opposite knee with your hand? I'm going to do this version. Of course, if you're standing, it's going to look like this. And we're going to go for 20. I will 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right, next exercise is marching. So if you're marching in the chair, I really want you to try and get your knees up as high as you can and swinging your arms. So opposite arm and leg. Again, if you're standing, get your knees up and swing your arms big as you can. We're going to go for 20 again. I'm going to count with me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Again, everyone working at your own pace. If you don't want to do any of these movements for that long, then tap out whenever you need to, after 5, after 10. The next exercise to warm up, finger flicks. We are going to throw our hands out in front of us, fingers wide, spaced apart, lengthen through your arms. With lots of effort, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Same movement, but overhead, if you can, for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and there's our warm up. So I hope everyone's feeling a little bit ready to do some exercises. We're going to go through 8 different exercises. The first one, we call it Sky Reach. So again, I'm going to show seated version and a standing option. Whenever you're sitting, if you're doing a seated version, if you can, sitting on the edge of your chair, not sitting way back, relax, but trying to have your body more active, sitting more on the edge of your feet, more on the edge of your seat with your feet firmly planted. So the seated version, we reach towards, I'm going to go with my right arm. I'm going to go for my left leg towards my foot. I'm going to come back up and look into the opposite direction. So I'm doing a diagonal pattern from one and all the way up to the other. If you were doing it in standing, again, spread your feet wide apart, bend your knees a bit, reach towards the floor, come up and look. Follow your hand, follow your eyes, so that you're tracking your hand. Your eyes are following your hand. Okay, we're going to do 5 on each side. So let's start. I'm going to go to my left hand to my right foot. 1, and look. 2, try and count with me. 3, 4, 5, and back to the other side. 1, 2, stretch out through your trunk as much as you can. 3, 4, and 5. Great. Next exercise. We call this the power twist. The seated version. I'm going to use my boom whackers. Now, these are essentially, some people may have used these before. They're like a plastic tube. Of course, I don't expect people to have these in their house. I'll often suggest people can use the core, the inside core of a paper towel roll when you're done with it, or the inside core of a roll of wrapping paper is quite a nice, firm and hard cardboard. PVC is a little bit too hard and can damage something, so I like people to, use cardboard, but you also don't have to put anything in your hands at all. I'm going to show you a couple versions. So if I had something in my hands, like say toilet paper rolls, arms are out wide, I am going to twist my upper body to bring my arms together to make a noise to hit the opposite one and open up. I'm going to twist over and open up. For people, okay, we're not using anything, arms are open wide, and you're going to try and clap your hands. Open up. Open up. If you're doing it in standing, same thing. You're looking to shift your weight. I'm going to turn to the right. Left. So I'm shifting onto my right leg when I'm turning to the right, onto my left leg when I'm turning to the left. And you should also feel the weight shift through your hips and pelvis when you're sitting. So let's try. We're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. Okay. Next exercise. For many people, we're going to, again, work on this idea of shifting our weight and rocking. So we're going to, in sitting, we're going to have this idea of a power rock. We're trying to rock to one side as we reach up, as if you were reaching for something in a cupboard. Come back. I'm going to reach with my other arm as I rock onto that hip. Come back. Reach, come back. And at the same time, I want people to have lots of power and pop their fingers out and hands are open wide. With each one, you're going to flick your fingers, open your hand. So in standing, it's going to look like rock, back, rock, back, rock, back. Okay? We are going to go to 5 to the same side. So pick a side to start with. I'm starting with my right side. I'm going to go 5 to the same side. 1, 2, 3, 4, 5. Now I'm going left. 1, 2, be sure to count with me. 3, 4, 5. If you feel you're counting too loud, then you're probably counting just loud enough. We're going to alternate sides now, going for 10. 1, back to the middle. 2, 3, 4, 5. Make sure you look at your hanging. 6, 7, 8, 9, 10. Very good. Next exercise. Many people who have Parkinson's are familiar with boxing as a great exercise for people with Parkinson's because of all the great things that boxing incorporates. Weight, shifting our weight from side to side, using explosive movements with our arms, having to step quickly. So we're just going to do a seated or standing. We're going to do jabs straight out in front. So if you're sitting, again, reaching forward, pulling the arm back to jab, reaching forward, pulling the arm back. Reaching forward, pulling the arm back. If you're standing, again, getting in a powerful stance, feet are spread apart, jab, forward, back. Each time, I want to make sure that people, you're not just doing small arm movements. You don't have to go fast, but I want the movement as explosive and as powerful as you can make it. I'm not worried if you're going much slower than I am. So here we go. We're going to do 10 jabs out front. 1, pull it back. 2, pull it back. 3, 4, 5, 6, 7, 8, punch hard. 9, 10. Okay, now we are going to do 10 across, so across the body punch. Okay, I'm sure anyone who's boxed is familiar with this, so we're going to cross the body. Again, if you're standing, Your weight should be shifting from one leg to the other as you're crossing. Here we go. 4, 10. 1, pull it back. 2, 3, 4, 5, 6, 7, 8, 9, 10. Great. And just for a little bit of a harder sequence, if people want, you can try doing a jab, jab with a cross, cross. So if we were going to do that for 5, it's going to look like, again, jab, jab, cross, cross. And every time I want people, once they punch, reset, punch, reset. You don't have to go at the speed I'm moving. If you're finding that's too quickly, go at your own pace, but look at more the quality of the movement. So, jab, jab, cross, cross. Again, jab, jab, cross, cross. Reset. Jab, jab, cross, cross. Reset. 2 more. Jab, jab, cross, cross. 1 more time. Jab, jab, cross, cross. Great. All right. We're going to just pause we're going to do a 10-second, what's called a voice boost. So again, we want to bring more attention, more awareness to our voice, to our breath. What we're going to do, we're going to take a nice breath in, and then when I say start, as we're exhaling, close your lips and make a sound as loud as you can, okay? So nice breath in. I'm going to time us. Breath in. That was 10 seconds. If you struggle to do that, that would be a great exercise to practice. Just trying to do that throughout the day. Kind of take a big breath in, and for 10 counts, either do a with the lips together or a ah is a great one too. Okay, we're going to do 4 more exercises. The next one called stop and squat. So if you're sitting, you're going to reach your hands forward as if you're going stop, don't come any closer, and then come back. Stop, lean forward, and come back to sit tall. If you're standing, it's going to be a squat, come back, up, squat, arms come forward, come back. So from the side, stop, come back, stop, come back. For 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I hope everyone's feeling a little bit out of breath. If, we want things to be somewhat challenging, a little bit hard. The next exercise is called a ta-da. These are some names that were coined by a therapist who works out of Australia, who works with Parkinson's patients. So I love this one. So I want you to think about you're entering a room and you want everyone to notice you, and you're going to have a big ta-da as you come into the room. So if you're seated, one foot is going to come forward and the arms come out, ta-da, and you bring and step your foot back. Ta-da, lean forward, step your foot back. If you are standing, pick up your foot. Big step, ta-da. Comes back, ta-da. Go from the side. Okay, so we are going to do 5 on one leg to start. Ready? 1. Come back. 2. Make sure your hands are open. Arms are straight. 3. 4. 5. Change legs. 1. 2. 3. Step that foot forward. Pick it up big. 4. 5. Okay, we are going to alternate the legs, same movement, but we're going to alternate. One then the other for count of 10. Count with me. Are we ready? 1, 2, 3, 4, 5, 6. Pick up that foot. 7, 8, 9, and 10. All right, the next exercise, this is a great exercise for many people. If you have any difficulty getting in and out of a car in terms of lifting your feet up to get into the car or get out of the car, or if you're in bed and you have trouble moving to the side, moving yourself over because you can't put your legs up in bed to move over and shift, this is a great exercise. I often will use a yoga block, but you can easily use a Kleenex box on the floor. Most people have one of those in their house. And the idea, if you're in sitting, so put the Kleenex box between your feet, and if I'm starting with my right leg, I'm picking my right leg over the Kleenex box, stepping with my left and stepping with my right. Then I'm coming back over the Kleenex box with my right and step. If I'm in standing, again, big feet, step and step and step. Back to the middle and step to the side. So we want to make sure that the legs come up big and you're always clearing that object. Step and step. So again. Step, leg comes over, leg comes back. Step, leg comes over the Kleenex box, leg comes back to the middle. Let's do 5. 1, 2, 3, 4. Last one. 5. Back to the middle. And the last exercise we're going to do is called a star. Well, I'll call it a star jump, but there can be modifications. I want you to think about making yourself as small as you can, so punching forward, curling up, tucking yourself in, and then we're going to explode out, making ourselves as big as we can with arms extended and legs out in front. So if you're doing a seated version, you're going to tuck into a ball and then explode out, making your arms and legs as big as you can. If you are standing, you're going to tuck into a ball, feet together. You can step into the star, and if you are working at a very high level, you could actually jump and come back, and jump and come back. But it's absolutely fine to be in standing and step into the star and come back and step and come back. But the idea is you want to make it a big explosive movement with lots of power and lots of effort. Okay, we're going to do 5. So make ourselves as small as we can and explode. 1. Down. 2. Tuck in. 3. Tuck in. 4. Tuck in. 5. Great. Okay. So that's the end of our, we're going to do a quick cool down. Hope everyone felt like they got a little bit of work in there and that they're feeling a little bit tired and things were a little bit challenging. So the cool down, we're just going to start rolling our shoulders forward. 1, 2, 3, 4, 5, and back. 1, 2, 3, 4, and 5, and turning your head, looking over one shoulder, and slowly turn your head and look over the other shoulder. Slowly change direction again, looking over your shoulder. And again, looking over your shoulder. Just gently let your neck roll down into like a half semicircle, half circle. And roll to the other side. And one more time each side. And okay, arms up. You can interlace your fingers if you like. If not, just have your arms straight up, lengthening through your arms, lengthening through your fingertips, being as tall as you can. Take a big breath in and lean over to one side, reaching, trying to make your trunk as long as you can, stretching out through your arms and your fingertips. Breathe. Take a breath in. Come back up to the middle. Breathe out. And go the other side. Reach as long as you can make your arms and your trunk stretching all through your side. Take a breath. Come back to the middle. Good. We're going to just do a bit of a stretch for our leg here. So if you were standing, leg goes in front of you, knee bend, and just kind of reach down as if you were brushing something off of your shoe. And 5, what we call scoops, or just as you're brushing towards your foot. Same thing if you're seated. So foot's up in front of you. If you can have your toes pointing to the ceiling and reaching towards your foot. If you can't get to your foot, just get as far as you can comfortably. 2 more. Change legs and reach as if you're brushing just the top of your shoe. 3, 4, and 5. And just a couple finishing breaths. Take a big breath in and out. And a big breath in and out. Thanks very much for joining me online for the exercises today. Certainly be happy to take any questions people have about today or in general,